Good morning, Your Excellencies, John Ward, Harvey Alter, and the Coalition, my colleagues from the New York office of WHO. I'm very pleased to be with you here virtually and sharing my vision and setting the scene from the global progress on the elimination of hepatitis. I wish I could be there with you today, but I'm really pleased that I could share what we see as some of the key shifts required to end the epidemic of viral hepatitis. Our global health sector strategies lay out a plan to 2030, but we still have gaps. But if we follow our strategic directions of delivering high-quality, person-centered services, optimizing systems, generating data, and being able to drive decisions based on data, engaging and empowering communities, and fostering innovations, we believe that we can do much more to reach those targets. But certainly we need to have greater public health awareness and a public awareness, as well as looking at investment cases and assessing public-private partnerships and domestic financing to be able to bridge the gaps. You'll see from the report that we have a long way to go. Currently, we have an estimated 304 million people living with hepatitis B and C, with 1.3 million people dying of virally related causes in 2022. Making viral hepatitis not only just an ignored communicable disease, but one where mortality is increasing, and it's on par with the mortality from tuberculosis. And what we've done recently is started to look at and equate, like with cervical cancer, how early infection can lead to later liver cancer, cirrhosis, and very large costs for the health system. We know that we have 254 million people living with chronic hepatitis B and 50 million people living with hepatitis C, and 10 countries that are carrying the greatest burden of hepatitis. If we could make an impact there, we could make an impact on reaching our SDG targets. But we still have huge gaps, certainly in testing and treatment. And we know in our report, you'll see that most countries are not accessing the lowest commodity prices that are available. For hepatitis B, unfortunately, 13% of people are aware and tested and diagnosed. Only 2% are treated. For hepatitis C, a bit better, with 36% diagnosed and 20% treated. We have a long way to go to close that gap. And the way to do it is to start looking at our prevention, diagnosis, and treatment through a public health lens, reducing the barriers and increasing the public health and community access to both testing and treatment. By 2026, to get on track, we're going to have to reach 40 million people with hepatitis B treatment and 30 million with hepatitis C treatment. It is a huge ask, but we know the people in this room are the people that can make this happen. We also have an opportunity with not only triple elimination, but also new simplified public health approach guidelines for treating hepatitis B. If we take those new hepatitis B guidelines alongside of our hepatitis C guidelines that are treat all, we should be able to reach more than 70 to 80% of those living with chronic hepatitis B. And we need your help to start to implement these recommendations. So thank you for your time. It was a very brief overview of our new report. And like on World Hepatitis Day 2024, now is the time for action. And we look forward to hearing from you how we're going to end the epidemic of hepatitis together by 2030. Thank you.